While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, we're going to talk about inflammation. Inflammation is at the heart of pretty much every chronic degenerative disease known to man. And it's at an all-time high, especially the past few years with more social isolation, people in the fight or flight response. So I brought in an expert on inflammation among many other functional medicine topics, Dr. Neil Paulvin. Welcome to this show, Dr. Paulvin.
Thanks for having me, Tim. Glad to be on.
Yeah, absolutely. So let's talk about inflammation and signs and symptoms of inflammation. I think most people know about redness and swelling as signs of inflammation, but what are some signs and symptoms that people may not be aware of?
I mean, it could be anything, like you said. It pretty much every disease process now has some incorporation of inflammation. Everything from heart disease, Alzheimer's to brain fog, skin aging, diabetes. Pretty much every chronic illness, as well as some acute illnesses, have inflammation involved. In terms of obesity, some female hormonal symptoms. All of that has some incorporated inflammation in there. So you got to keep it under control.
Absolutely. And we know that there are some tests such as C-reactive protein or high sensitivity C-reactive protein as an acute phase reactant can show inflammation. What are some other tests that people may consider in terms of looking for inflammation?
I mean, there's a lot of different tests. Nothing is besides sed rate and CRP. Those are going to give us some ideas of general inflammation. And then what we try to do is look at a couple of things, both systemically, and then you can go kind of area by area. So in terms of more general things, we know that patients who are insulin resistant have increased inflammation. So that's definitely a marker. We look at inflammation related to cholesterol. That's part of our test. We're going to look, if somebody has any type of liver test that will show inflammation. So we're looking at their specific liver tests. Uric acid now has been linked to more and more inflammation. So there's a lot of different systemic markers that we look at. Hemoglobin A1Cs give us an idea as well. We need to look for inflammation if it's elevated. And then we kind of go down, like I said, more to the local area. If we're looking at the heart, a lot more patients now are getting calcium scoring and what's called a clearly to look at heart inflammation. Obviously, a lot of people now are getting different testing done to assess brain inflammation, from just a traditional CAT scan MRI to people are either getting SPECT scans or QEEGs to look at the inflammation and to get an idea of the functioning of the brain. And then we can look at the inflammation of the blood vessels, do different tests. So it goes down. I mean, right now, luckily, in the last 2 to 3 years, our diagnostic tools that are available to everybody is greatly increased. One of the tests I'll mention that gives a lot of information, one pretty inexpensive test is a DEXA scan, because it's going to let us know, again, how the bones are. It's going to let us know about visceral fat, which is probably one of the biggest factors in terms of inflammation throughout the body. It's going to let us know about muscle mass, and if there's poor muscle mass, that can also lead to inflammation. So that's kind of a test that gives a lot of information in one compact exam.
Yeah, well, thank you so much for that thorough answer. But Neil, let me ask you this. So I remember being in school, learning, and this is kind of a recurring theme where they teach you that adipose tissue is structural, right? And then now we know that it's a highly active metabolic organ. It releases inflammatory cytokines like TNF alpha. So how much of a role does visceral fat play in predisposing you to chronic disease?
And in most patients, it plays a role. If there's a decent high enough percentage of it. Again, like I said, we know it's linked to diabetes, we know it's linked to early menopause, it's linked to obesity, it's linked to heart disease, it's linked to potentially some brain neurodegenerative issues. So it's involved in something. Again, you can't measure what you can't treat what you can't measure, don't measure. So again, that's why we're looking at more and more in terms of trying to get an accurate level, because that's going to help us determine what we need to do in terms of treatment.
Absolutely. And when a patient or a client first comes to you, do you have a certain set of tests besides a comprehensive metabolic panel that you do to sort of get them started?
Yeah, I mean, I kind of like what I just went through a lot of that's ordered. We'll also usually do a stool test to assess the inflammation in the gut, usually through a calprotectin, and the EPX, eosinophil protein X will give us some information. So again, a lot of it we will tailor to patients if they're coming in with specific complaints. If they're coming in with gut issues, we're more focused on that obviously than doing a brain scan, but we can mix and match. But a lot of what I mentioned is what we will put our patients through, depending on what they're coming in for.
What are some treatments that you're doing in your office that you're really excited about and are really cutting edge?
For instance, I mean, there's a lot we're doing here. I mean, there's some things that we're hoping to get soon. We're doing everything from, again, we do peptide therapy, which has been an amazing, pretty easy treatment for a lot of inflammation, both locally and systemically. And it's great because we can inject it into a joint, we can put it into an IV, we can have patient take it systemically, we can use it as a cream if it's just a topical issue. It works great for skin. So that's something we definitely use. There's certain supplement, and then we're also using some exosome treatments, which are little kind of carriers that go between the cells that have been shown to be really helpful for inflammation. We've started doing EBO, which is kind of like, the way I explain to patients is it's kind of like the getting your oil changed in a lot of ways, that we take the blood out, clean it with ozone and some light frequency, different frequencies of light, and then put it back in. And that could be great from everything from autoimmune to just overall joint pain, because it gets rid of some of the inflammatory markers. Those are the main things that, again, we do specific pain IVs. We do a lot of different joint injections with pretty much everything from exosomes to peptides to old school like neuroprolotherapy, which is injections with sugar water, which is kind of become, it's old, but it's also kind of become new again. So all those different things. The one thing that we use that don't have in the office specifically is hyperbaric, which is also incredibly helpful for pain, but it's something that you need to be doing on a pretty continual regular basis. We do red light in the office, red light therapy, both local and systemic. So those are some of the things that we're doing now to help patients deal with inflammation.
Yeah, I just had 2 months ago, I had 4 EBU treatments at a college clinic in Idaho. And I don't know if you get a lot of foam and fluid coming
Yes.
out in the filter. During 2 of my IVs, 2 out of the 4, I had that coming out. The first and the last I didn't, but the middle 2 I did. But in my experience, because I've had tin pass ozone as well, it doesn't sort of whack you over the head as strongly as tin pass ozone, but it works longer, if I'm not mistaken, correct?
For most patients, yeah, that's the general thing that we see. EBO is kind of the cleanest. It has the most broad use, and again, like you said, it lasts longer. Yes.
Absolutely. And have you treated any patients with chronic infections with EBU?
One or two. That's not as much for our clientele yet. We're getting more and more now that we're doing these different treatments. We've had a couple. I mean, we had a chronic Lyme, we had a mold. Unfortunately, some long COVID patients. So that kind of wraps all around that spectrum there. So yeah, we've done some getting more into it now.
So one thing I wanted to touch on is when people are in a fight or flight or sympathetic dominant state, they're more likely to be inflamed. Is that something you see in your practice?
Yeah, no, definitely. I mean, when like if their sympathetic system's going from stress or an illness or lack of sleep or all of the above, yeah, it's going to increase the amount of cytokines, the inflammatory cytokines that you talked about before. And we work on our patients to, I mean, either do things as simple breath work or products like Apollo Neuro, or there's tons of stuff out there now, or burn tap, or different technologies that we use to augment what we're doing in terms of injections or supplements or medicines, whatever we're using.
And ketamine, let's talk about ketamine as sort of since we touched on the autonomic nervous system, as sort of a reset for the autonomic nervous system. Have you had any great case studies that you can share with ketamine?
Ketamine, yes. I mean, I've had patients who I like ketamine in different ways now. I work with a doctor who does some very advanced techniques with it. I've seen more pinpoint results, which is the way I like doing the ketamine. I think ketamine is great for patients who have like a chronic reflex, a CRPS issue, or we call it like when their pain is a brain modulated, where the brain is perceiving the pain greater than the body. That's where it works well, because it acts like that reset button on your computer, which I really like. But otherwise, the main thing we use the traditional ketamine for is anxiety, jet lag, kind of those things, and a little bit of chronic pain to get us started. And then we're going to do more local things that I find, like the doctor I find works a little bit better. Again, I think ketamine's a really broad sword in a lot of ways, and patients have to understand kind of the plus and the minuses to it. But I think it has a lot of potential now that we're able to kind of do more specific things with it.
And if you don't mind me asking, what's the general dose that you use in terms of grams per kilogram of body weight?
I can't even, I don't know how we do so many different procedures. It's not even a set number at this point.
Gotcha. Okay. And have you ever combined ketamine with something like oxytocin nasal spray?
We do. I mean, I'll do that even with patients orally, like they're doing this troches, which are the sucking candies, or the nose spray, and the oxytocin. We may combine that even with an RG3. We combine it with methylcobalamin, NED, cerebrolysin, which is a peptide. But again, we mix and match. That's what's great. Again, I find ketamine, I find it better either at home, where we're doing a more focused treatment with other things added to it, or again, doing the more pinpoint things here. It has great potential. It just has to be done the right way, because the potential for abuse of it compared to other things. And it's kind of hard I kind of compare it sometimes to a 17-year-old driving a Ferrari. It's incredibly powerful, and you may not know exactly where it's going to go. So you really got to work hard to control. But once you figure that part out, it works really well.
Yeah, I don't know if you treat a lot of people with substance abuse issues, but I've read some studies that looked at the concomitant use of ketamine with oxytocin, and the rate of the success rate is really high. Have you seen that in terms of the ketamine? Because it seems like people are less likely to abuse substances if they use things like ketamine.
We don't do really any substance abuse here at all. I know that I've seen other doctors have told me that. I've seen the studies that show that. It definitely has a great niche in terms of substance abuse. Again, it's just not something that I do a lot of at all. It's just not part of my practice, really.
And so you obviously are doing a lot of advanced techniques in your office. What are some lifestyle hacks and biohacks that people can do at home to control inflammation?
I mean, the simplest one is sleep, obviously, maintaining that, getting a good, the same amount of, sleeping the same hours every day. Trying to go to bed before 11, get up after 7, get morning sunlight. We know sleep is anti-inflammatory, because that's when all your anti-inflammatory chemicals are being recycled. And it's also good to go get the morning sun. That helps to kind of, again, we know there's association in circadian rhythm and inflammation. That's the first thing. The other thing that patients can do at home There's a couple of different things. It depends how advanced they are and how much they want to do. I love patients who are doing at-home red light therapy on a regular basis. I have patients, you mentioned I have patients doing, obviously doing at-home breath work. Um, I like my patients also doing a lot of fascial release techniques. I have a lot of athletes. So either doing, a lot of them will do gua sha at home. Gua sha looks like a little letter opener. It became very popular. Everybody talks about the face part. A lot of that's what you saw like on social media, TikTok and stuff, but it actually works great for your hamstrings, your forearm muscles. And that's a great way to kind of control inflammation. And then those are kind of some simple ones people can do at home. Obviously maintaining the stress, find that the way to deal with stress. And then again, there's certain supplements I recommend to my patients to help them control inflammation.
Yeah, absolutely. I have wash shot tools in the other room. I used to use Graston tools, active release technique for trigger points and fascial restrictions. And your background is as a DO and family medicine, correct?
Yes.
So do you still do manipulation?
I do it. I do it less. I do still do it a couple times a day. I mean, it's a nice tool to have in my back pocket because I can do all these high-end treatments if their thoracic spine is locked up or their levator is not moving, levator scapula is not moving. It's only going to go so far. And like, well, I'm doing all these things, taking all these supplements. Why are things not working? If you do a 5-minute technique to release something, or do a suboccipital release to help someone with anxiety, they're like, wow, that's a miracle. And it's takes 5 minutes to do, and it's not an injection, and it's not expensive, and it's a great little tool to have in my toolbox.
Yeah, and when you do a manipulation, it helps to modulate the autonomic nervous system as well, correct?
Oh, definitely. As I said, suboccipital. We'll do some sacral release. All that simulates the parasympathetic, gets the vagus nerve going. I diaphragm work. All that works really well.
Yeah, I think breath work is highly under estimated. I know that the bottom inferior aspect of the diaphragm is replete with the parasympathetic fibers. So you probably do some fascial or visceral manipulation, I'm guessing, for
Yes,
diaphragm.
exactly. hmm It
Yeah,
works.
because
It works really quickly. It hurts like the Dickens, but it works.
it's worth it. It's worth it for sure. But yeah, we don't breathe, and the more stress we get, the less we breathe, or the less well efficiently we breathe. So I think that's a great way to control inflammation, especially combined with the red light therapy, because I'm all virtual now, but when I worked in a physical office, it was great to have people come into the office, and we had a nurse practitioner doing IVs. But if they went home and ate inflammatory foods, didn't get sunlight, stayed up until 2 in the morning, and the treatments, they didn't last. They didn't stick around very long. Is that what you witness as well?
Yeah, exactly. I tell patients it's a safety deposit box method. You have to turn all the keys at the same time. If not, things aren't gonna, like you said, aren't gonna last as well.
Awesome. So some things that you know now, because you've been practicing for over 20 years, correct?
Yes, yes, it's been a while.
I mean, I know you're only 29, but you're like we could
Exactly.
have,
Thank you.
yeah, yeah, your telomeres are getting longer, right? That's the functional medicine equivalent of aging like a fine wine.
There you go.
But so what are some things that you're doing now that you could have never foreseen yourself doing even 10 years ago?
Um, I mean, there's a couple things. I mean, doing breath work and meditation 10 years ago, if you had told me I'd love it, I thought there was an issue there. Probably cold plunges, cold immersion is probably the other one that I never thought about, but I mean, it's something that I've grown to really enjoy doing. So I think those are probably the two main things that are kind of on the top of the list there.
Awesome. And let's talk about elimination diets, anti-inflammatory diets. I know you work with a lot of athletes. Do you think it's necessary for athletes to have significant amounts of carbohydrates? I know athletes who are on the keto carnivore diet. What are your thoughts on that?
Everybody's individual. That's why, again, I go back to what I said initially in the beginning. It goes, you look at the data is number one. Two, it's going to be, we're doing like VO2 max testing. Are they converting between, are they metabolically flexible, meaning that they can go between carbs and fat? Are they a sprinter? Are they a marathon runner? Are they, again, a baseball player who's pretty stagnant during the day? Again, it depends. Again, all of them have different requirements. I want, they all need carbs. I mean, it's just a question of where you're getting the carbs from. I mean, my go-to for most patients is a diet that's gonna, if they're going to build muscle, that's going to help them build muscle, maximize muscle building, as well as decrease inflammation, and then we backwards from there. I'm not, beyond that, I'm not as restrictive or as I used to be in terms of the macros. I just find it doesn't work because I've just seen it work for everybody. I mean, different things work for different people, and that's fine. My goal is to get you from A to B. I don't care how you get there. So again, I definitely like them to have more protein at the beginning and end of the day and get most of their carbs in the middle of the day because of the insulin spikes and sleep and so on and so forth. But you need carbs. I mean, that's just simple. I mean, my keto athletes are very good at it. A lot of my keto athletes are cyclic keto, meaning that they're going to have either a binge day or a binge week, or they take a break every 6 weeks, or 8 weeks. They know what they have to do, and it just works for them. Their body is they're very metabolically flexible, so they can turn the switch on literally like that. But I don't believe, I used to be, okay, you're going to be either this or this, and that's not what the data shows anymore. And we have so much more testing now that we can do pretty accurately, that if their data says that there is, or they're very insulin resistant, then we're going to lower carb, maybe a little more fast to get their things right. Again, you've got to take all the data and mix and match, but that's what makes the job fun. Nobody's the same.
Right, exactly. And one thing that I'm seeing more and more, like I know the Minnesota Vikings, they have a room with full body red light panels on all four walls, and the athletes kind of rotate around every couple of minutes. Have you seen a lot of increases in athletic performance by helping to modulate mitochondrial function?
Yes and no. They're doing it. They may not be doing it for that specific reason yet. I mean, there are some teams that are that in depth. I mean, a lot of athletes now, I mean, athletes 5 years ago, and I think it was LeBron and actually Terrell Owens used to be a receiver for the 49ers. He had a hyperbaric unit he used to carry around with him. And he was like, what the world are you doing? Now it's pretty commonplace that they're using a hyperbaric for inflammation and to help with the mitochondrial health. But now patients are they're doing red light therapy. They're doing cold help, which induces mitochondrial biogenesis, which is development of new mitochondria. They're doing IVs to boost it, or supplements to boost. But again, if they're professional, the rules are a little bit different than everybody else. So they're doing sauna. Again, they're doing all these different modalities to definitely augment the mitochondria as much as they can. And again, an athlete now, I mean, I work or we're friends with different people who are trainers or doctors to athletes, and it's now almost more about the preparation and the recovery than it is just about game day, which is the way it has to be. I mean, other something that a lot of athletes are using is exogenous ketones, which does a lot of different things in terms of, and we talked about inflammation in the beginning. It's one of my favorite anti-inflammatory things, especially for the brain. The data is, but also we know now it increases the EPO, which is the erythropoietin, which helps the body carry oxygen. It boosts dopamine in athletes. It helps with endurance performance. So it does so many different things in something that's a pretty easy thing to get. Tastes horrible, but otherwise has a lot of benefits to it. And also, again, has some mitochondrial benefits as well.
Is methylene blue something you've used for inflammation and mitochondrial function?
I love it for mitochondrial function. I love it for we talked about some chronic illness stuff in the beginning. I love it for Lyme. I like it for chronic long COVID. I like it for like my neurodegenerative patients. I also love it as a biohack. Again, it's one of those things now where it's something that it's not the same dose for everybody. I mean, I have a patient who was here yesterday, can barely tolerate like 4 milligrams. Other patients were like, oh, well, they say I can do 100 milligrams. So it's just, you got to I always tell patients start slow with it. It does work really well. If you just the little public service announcement, if I don't put on anybody who's on any type of SSRI or psych therapy, you want to definitely talk to your doctors about that. have some issues there, but it has great potential. Now we're trying to really figure out the best way to do it. We do a lot of IV. We mix it potentially with our EBO, with our ketamine. It has a great benefit for all those types of patients.
Yeah, I think the data or the statistic I read was it increases mitochondrial respiration by 30 something percent on
At least,
average.
yeah. Mhm.
Yeah, and
I've seen
so
higher even, yeah.
yeah, and I think it's also really good for Bartonella, one of the Lyme co-infections, which I had myself. And I got that in combination with the EBU, and man, I felt like Superman.
If for a lot of patients, again, that's what I'm saying. It's a great combo.
Yeah, absolutely. Any parting words of wisdom, action steps that you can give to listeners?
Two things. A, listen to your body, especially in terms of inflammation. If you're feeling brain foggy, if you're gaining weight, especially in the abdomen, then there's something going on. And if the doctor tells you you're okay, you're in the quote unquote normal range, you may want to find another doctor, because there's things now that we can do to fix it. And everything starts with lifestyle changes. You could be on the coolest new supplement or methylene blue or ebu or anything of those things. If you're not sleeping and exercising, it's only going to go so far. Like you said, you got to fill the bucket faster than it's leaking. It's that simple.
Absolutely. Well, you're a wealth of knowledge. Your patients are lucky to have you. We'll put all your links in the or on the website and on social media. And hopefully we can have you back on again in the future.
That would be great. Thanks for having me on. It was fun.
All right. Take care. We'll see you
Bye.
later.